Okay, I'm going to verify my patient's order from the physician for trach suctioning to indicate if he needs as needed suctioning. I would listen to his lung sounds, see if there's any visible secretions, if there's any kind of gurgling, rhonchi, your wet lung sounds that could indicate the need for suctioning. Once I verify my orders and verify the need for the suctioning, you identify your patient along the way. This is Mr. John Doe, date of birth, January 1st, 1990. If you had a wristband on, I would scan it, verify it with the computer. I've gathered my supplies. I'm going to cut the oxygen on. It's going to be between 80 to 150. Got my cable within reach. At this time, I'm going to hyperoxygenate them, and that's either going to be increase the settings on a vent or tell them to take several deep breaths, whatever means that they are receiving oxygen through, just increase that oxygenation before starting. While that's occurring, I'm going to don my gown and my mask. So I'm going to put my gown on first, especially if they are infectious. Okay. Got my mask. Go and wash my hands again. Okay, so I'm set up. They're hyperoxygenated. I'm going to start by loosening the cap of my water. Okay, and now I'm going to open my kit. I'm going to peel back the lid and retrieve my gloves. Making sure only to touch the outer borders of the packaging. Try not to contaminate my catheter. Okay. I'm going to glove my dominant hand. Okay. And now I'm going to glove my non-dominant hand. Okay. So now I'm done with that. So, bring that closer. Now, this hand is going to get contaminated. So I'll remove the lid on my bottle. I'm going to retrieve the catheter. Okay. I'm going to pour my water. Set that out of the way. This is sterile. I'm going to move it. Okay. I'm going to grab the suction, connect the catheter. We're going to lubricate. Suction, suction. Okay. And now we're going to start inserting. We're going to go approximately 5 inches, but depending on where we meet resistance or if the patient starts coughing. So we're just inserting, and while we're inserting, we're not applying suction. We're waiting to meet that resistance. Okay, we're meeting resistance. So now we're going to start pulling it back out, and while we're pulling it out, we're intermittently applying suction and twisting the tube between our fingers as we retract. Okay, we should not exceed 15 seconds on that suctioning, and then we can rinse and continue. At this point, we're done. We would assess for further need of suctioning and assess the patient's tolerance of the procedure. The end.